there are two broad types of meniscus tears. The meniscus is essentially like a piece of rubber within the knee that acts as a shock absorber. And the tears can occur either through traumatic events or through degeneration. So what that means is if a patient has an injury to the knee, they have a trauma to the knee, they can tear the meniscus, and degeneration occurs as we'll progress with time. We get wear and tear in our knees, and sometimes they're associated with osteoarthritis, which is degeneration of the cartilage within the knee. If a seriously torn meniscus tear is left untreated, the outcomes can be variable. So the outcomes depend upon the patient's age, the type of the tear, and the location of the tear. Sometimes, if they are left untreated, they can cause significant symptoms such as pain and swelling and catching and clicking within the knee. And if that happens, the meniscus tear can, which is not treated, can potentially get worse as it gets caught in the knee and contribute to increasing symptoms. Along with that, with the damaged, untreated meniscus, the other issue that can occur is wear and tear, so early arthritis within the knee. So a seriously torn meniscus is something that should be looked into. There are two broad issues with minor meniscus tears. One, they can be treated non-operatively, and sometimes they may settle down. It may take 6 weeks to 12 weeks for that to happen. But again, this depends upon the age of the patient, the type of the tear, and the location of the tear. And in answer to the question, not all of them require treatment that involves surgery. Sometimes we can manage them non-operatively with things such as physiotherapy, activity modification, and oral painkillers as required. Surgery is not the only way to fix a torn meniscus. Not all torn meniscus need an operative intervention. Some, depending upon the type and the location, may settle down, but this takes approximately 6 to 12 weeks. There are two broad options available for meniscus tear surgery. One is removal of the meniscus or the damaged fragments, which is called meniscectomy. And number two is meniscal repair, where we take a look inside, put the meniscus in an appropriate position and fix it using keyhole surgery with special types of suture anchors. Not all meniscus tears heal without surgery. On the balance of probabilities, if it's a significantly torn meniscus which is displaced, it will not heal. If it's a minor, small peripheral tear in a young patient which is not displaced, it can take anything from 6 to 12 weeks to heal without an operation.